you think about mouth breathing, if you're to open your mouth, that's going to guide how your face develops because the
Right.
tongue is actually nature's expander. So when the tongue is resting high, it's actually expanding your face not only this way, the way we see orthodontics working, but it actually develops the face this way. So when we're
Mm.
looking at women, actresses, models, what do their facial structure look like? They have nice broad cheekbones, nice
Mm.
jawline, lips, a chin, a nose. They're structurally developed in a way that's considered aesthetically pleasing.
Very
Mouth breathing
pronounced.
doesn't support that. Mouth breathing creates long, narrow faces, short chins, noses
Mm.
that stick out further because
Mm.
this portion of the face is not as developed as forward as it should be. And orthodontics braces do not address that.
Welcome to the Self Care Goddess podcast, where healing stories, practical self care strategies, and science backed tools to regulate stress, feel calm, grounded, and energized come together to help you reclaim your vitality. I'm your host, Rita Savoya, holistic nutritionist, trauma informed breathwork coach, and founder of Breathwork Barista. This podcast is for women who are ready to restore their energy and radiance, reconnect with their bodies, reawaken their inner power, and redefine self care as a way of being. Through science meets soul practices, restorative mind body tools, and real stories of transformation, we'll explore how true well being can help you live with more joy, vibrant health, and authentic connection to yourself and those you love. Take a deep breath in, let it go, and let's begin. Hello, hello, and welcome to another episode of the Self Care Goddess podcast with today's theme, the hidden connection between your mouth, your breath, and your health. Super, super excited to have our guests here today. But as you know, on this podcast, we're going to walk the talk and just take a few moments out of our busy day to just check in with our bodies, with our mind, with our heart. So I invite you to, if you can, lower your gaze or even close your eyes to really tune out what's going on and just follow your breaths, inhaling through the nose and then letting it go through the mouth with a gentle sigh. Inhaling a little longer, a little deeper than usual, and then letting it go, releasing anything that feels heavy, that feels there's some tension there. Just let it go, using the power of the exhales. Inhaling, feeling the expansion of the breath, and then letting it go. Beautiful. I now invite you to channel the breaths into the area of the heart where attention goes, energy flows. So let's energize this incredible organ that's keeping you alive. And as you inhale in and out of the heart area, I invite you to visualize someone that you're grateful for today. Gratitude is such a powerful emotion. So let's show some loving and appreciation for this person. And now I invite you to send that same love, same appreciation that you just sent out to the special person. Send it back to you for being here, taking a time out of your busy day and just choosing you. On your next inhale, flutter your eyes open and come back to us. So thank you for participating in that quick coherence technique from the HeartMath Institute. So today's guest is someone who is helping us understand just how foundational our breath and our oral health are to our overall well-being. Alex is a biological dental hygienist and myofunctional therapist based in Kingston, Ontario, and the founder of Functional Oral Health. Through her work, she supports children, teens, and adults in addressing breathing challenges, improving sleep quality, and optimizing facial development. Her approach goes far beyond traditional dentistry. Alex focuses on restoring proper oral function through breathing techniques and myofunctional therapy, helping to retrain tongue posture, movement, and the way we breathe, which has a profound impact on the entire body. She is deeply passionate about getting to the root cause of airway health challenges, taking a truly holistic approach that considers everything from nutrition and environmental toxins to movement patterns and even the impact of modern technology on our development. And this work has been part of her life from the very beginning. She grew up in a dental office, quite literally born into the profession, which sparked her early steady passion and curiosity. And these days, you'll often find her enjoying her favorite ritual, a warm beverage like matcha chai or mushroom coffee. And if her life had a soundtrack right now, it would be Still Standing, reflecting her journey of bridging traditional and modern approaches to health. Alex, welcome to the Self Care Goddess podcast. How are you today?
Thank you, Rita. I'm doing well. It's a beautiful sunny day out there.
Thank you. Awesome. Not for us, but yeah, I guess Kingston is a totally different, is having totally different weather. So give us a little more background. I know I read an amazing bio on your personal journey and what's inspired the mission that you're on today.
My own personal journey started actually with my father. So he's now a retired biological dentist, and he
Mm,
always looked at things from a holistic standpoint. Why are my kids developing cavities? Why do they have crowded teeth and major structural issues? Why are we taking out wisdom teeth on every single child in North America? Because we're telling everyone there's not enough space. So he started really diving into the whys behind all of these questions. And it was not a big topic 20 or 30 years ago. So I feel like the last 5 to 7 years, which 7 years ago
mhm,
started my practice, that everything has started to change because now parents in my generation are asking for their kids, what can we do to prevent orthodontics or to prevent, the types of treatment plans that are a lot more aggressive and a lot more involved. So it was my own journey through my upbringing and watching my father's education journey is where my journey started 25 years ago. And it still continues to this day.
Wow, that's incredible. So I actually thought biological dentistry was something that was fairly recent. So it's been around for a while.
It actually was first talked about from a dentist and physician, Dr. Weston A. Price, who
Oh, right.
started the Weston A.
Yes.
Price Foundation. So that was a dentist in the 1800s talking about why faces were changing. And he would go to certain tribes across the globe that had not been exposed to processed foods, spent a lot more time in nature, and realized once you started introducing the common three, which is dairy, sugar, and grains, then their faces were changing. They weren't as broad. They didn't have these nice big smiles. They were more prone to cavities and they were more prone to dental infections.
Wow. And so that's right. Because I studied this. I totally forgot about it. That's great. Thanks for the reminder for sure. And so you would consider this still in modern day today in terms of what is happening with our facial structure in kids? Are those still the culprits or there's more to add to that, unfortunately?
Yeah, well, I'm going to say the airway epidemic or revolution has started in dentistry over the last 5 years. I have to say, 2020, that was probably one positive thing. Parents
Mm-hmm.
were starting to ask deeper questions about health and supporting their health through alternative. I hate to say alternative, but it's more getting back to nature. And so when you look at things from an airway, holistic, biological perspective, it's getting back to whole foods. It's spending more time in nature. It's spending less time on technology and eating foods that are accessible within our communities. So, depending on where you live in the world, fish might be a really good option for some cultures. If you live kind of where I live, there's a plethora of options from local farmers producing lots of fruit, veggies, meat, poultry, eggs, all these things. So, I think the more we get close to nature, then we're going to have less of these health issues. And with watching my parents, they had this biological dental practice just outside of Kingston, Ontario for 35 years. I was able to see the trends that were happening in this kind of cohort of the population. All these families that are eating really well and, maybe homeschooling, spending more time in nature, not having their lives dictated by technology. And they were still running into issues. They were
Mm-hmm.
they were still noticing that their kids were developing cavities. Maybe their babies were struggling to breastfeed, and they were trying to figure out what are the other silos of health that we missed. And that's what kind of led me down the path of airway-centric dentistry, which talks about how we breathe, myofunctional therapy, doing you mentioned myofascial. Myofunctional and myofascial get confused quite often. So
Mhm.
myofascial is the whole structure, the whole body. Myofunctional is typically from the shoulders up. So
Oh, okay, I
yeah,
see.
when I'm working with families, I say I'm like a personal trainer from the shoulders up, helping to support musculature, tone, and function, and to support breathing through the nose. And
Right, right. And tell us a little bit more, like, what are we doing wrong as society? How can we go back to how we're supposed to be breathing? So what are the most common things that you see in people that we're doing improperly?
so I noticed that we've stepped away from being well regulated and in tune with ourselves. I
Mm,
feel like when these portable devices became more accessible,
mhm,
anytime someone feels bored, anxious, doesn't want to think about something, maybe doesn't want to connect, they instantly connect to their devices instead of themselves. So it's bringing that awareness back to how we're feeling and then how our nervous system is impacting how we breathe. So we can change that in any environment that we're in. It's the first thing that we can connect to and automatically make that shift. So that's what it comes back to is, are you willing to, you know, the practices that you've done with breath work, it's all about getting into your body and
mhm,
being able to connect what your nervous system health with your breath work and doing different types of practices to help support that. So it's interesting because when I'm talking about breath work, I talk about it like a tree. There's all these different types of breath work, and they're all great, and they all have really great modalities and functions like Wim Hof, pranayama, holotropic breathing, like all these different um, philosophies on breathing. But the breathing that I primarily focus on is how we should be breathing 99.999% of the day. When you're
mhm,
driving in your car, when you're on a Zoom call with someone, when you're going for a walk, when you're at the office, listening to a conversation or um, being present in the moment. We should be breathing light, slow, and deep through our nose, and we should be activating the lower portion of our rib cage.
Yeah, so very similar to what Patrick McEwen teaches, the
That
LSD method and the diaphragmatic breath. So
that
tell us, in your opinion, how detrimental is mouth breathing versus nasal breathing and why we should be primarily nasal breathing?
I always say nose versus mouth. So mouth breathing is like I like to use this analogy, like a car analogy. If you were to breathe through your mouth, it's like rolling down the window. Everything gets it. So you're not filtering any of the air particles, it's going to impact inflammation in the body. So we see that from a dental perspective, it actually changes the pH in the mouth. So you're more likely to get cavities because our
Mhm,
saliva is actually nature's toothpaste. It's the
mhm,
best toothpaste that you can't buy. So taking care of the saliva and making sure your teeth are bathed in saliva is going to support microbiome support, mineral and nutrient absorption, and prevent inflammation in the mouth. The other component to that is if you're breathing primarily through your mouth, you're more susceptible to get inflammation at the back of the throat. And we see a lot of kids with tonsils and adenoids that are more inflamed these days. So the
mhm,
tonsils are at the back of the throat. If you were to open your mouth and say ah or stick your tongue out, you may see these pillars on the sides. There's this tissue, lymphatic tissue called tonsils. And I see a lot of kids struggling with inflamed tonsils and adenoids. I wouldn't say mouth breathing is number one reason why that's happening, but it's
mhm,
definitely one of the pillars of contributing to enlarged tonsils and adenoids.
mm,
So when we're breathing through our nose is designed as a filter. It moistens, warms, and filters the air as it enters your nose. And then, as Patrick McCowan talks about a lot, when you breathe out through your nose, you actually allow for nitric oxide to be produced in the
mhm,
nasal passages, and you allow for um, vasodilation so that you're able to actually get more oxygen and blood flow into other areas of the body. Because when you mouth breathe, you don't get that. You get
right.
stuck more in sympathetic fight or flight response.
So they removed my tonsils when I was in grade 7. They don't remove them as easily nowadays, right?
They
Do you
do. They
Mm,
do, depending on the size of the airway. So if we're seeing a child with chronically inflamed tonsils and
mm,
adenoids, they just can't breathe. They're breathing through like a coffee stick, stir stick, like a lot of kids that I'm seeing, then they may start with a cortical spray, corticosteroid
mm,
spray to help
mhm,
reduce the inflammation for a 30, 60, 90-day protocol. If that doesn't work, then the next mode of action is typically to remove the tonsils and adenoids. But
Mhm.
the good news is they never remove them completely.
Right.
They
Mhm.
always leave some of the tissue. So we actually see them grow back a lot. So
Okay.
I've seen children that have had their tonsils and adenoids removed. And then as adults in their 20s, 30s, and 40s, we are retaking scans and it's showing that that
Wow.
tissue is back. And even 5 years later, children that I've started working with in my practice, I started my
Mhm.
practice in 2019, we're seeing their tonsils and adenoids grow back because the root causes were not addressed. So
Mhm.
you may still have them more than you think.
Interesting. Yeah, I'm gonna look into this. So, how does this poor breathing or dysfunctional breathing impact our facial development, especially in the development years?
So if you think about mouth breathing, if you're to open your mouth, that's going to guide how your face develops because the
Right.
tongue is actually nature's expander. So when the tongue is resting high, it's actually expanding your face not only this way, the way we see orthodontics working, but it actually develops the face this way. So when we're
Mhm.
looking at women, actresses, models, what do their facial structure look like? They have nice broad cheekbones, nice
Mm.
jawline, lips, a chin, a nose. They're structurally developed in a way that's considered aesthetically pleasing.
Very
Mouth breathing
pronounced.
doesn't support that. Mouth breathing creates long, narrow faces, short chins, noses
Mhm.
that stick out further because
Mm.
this portion of the face is not as developed as forward as it should be. And orthodontics braces do not address that.
They just address the straightening of the teeth.
Just the straightening of the teeth right here. And then have someone
Wow.
sideways look at their
Mhm.
profile before they start braces and after they finish braces. If an
Mhm.
airway centric approach wasn't considered,
Mhm.
then you're going to see structural changes to their profile and not always the most aesthetically pleasing result.
Yeah, that's so sad to know that, it could have been prevented because we can reverse this. Up to what age can you reverse, in your opinion? Adolescent years?
So around 6 years of age, 60% is the face is developed.
Mhm.
So I'm looking at children with their first adult molars that come in. That space typically does not change into their adult years, their teenage, pre-adolescent, teenage, adult years until they make breathing changes and go through types of expansion where they're, broadening the palate and the airway and working on a program to help strengthen and tone the muscles of the face. And the
Mm.
first phase before we can do that is breathing. Because if your
Mhm.
tongue can't rest high because you can't breathe through your nose, then your tongue is going to go down and your mouth is going to open because you're using that as the first line of defense.
Mhm.
So
So
this is
where
why
should Oh,
sorry,
I'm
go
sorry.
ahead.
Oh, no, go ahead.
So this is why I focus on Patrick McCowan. You mentioned the oxygen advantage. I focus on the Buteyko method of breathing and I incorporate it into my programs as the first phase because once we can address mouth breathing and support nose breathing during the day and at night, because at night we produce a lot of growth hormones. So a lot of changes are happening at night and they're even noticing as adults, even though we're told our face is developed, all the cranial sutures are fused, which, there's mixed messages on that now in different communities. But I'm seeing adults' faces change when
Mm.
we focus on types of airway
Mm.
scent orthodontics.
That's exciting news. Great
It
news.
is.
Right.
It's not as dramatic for
Right.
children or for
Mhm.
adults as it is for children.
Mhm.
So
Right,
we
right. And so where should we position where's the correct positioning of the tongue?
So when I'm going over this with families, the very first thing I get them to do is look at the roof of their mouth and see what their arch form looks like. Because if your teeth, there's so much space in there, then that means the garage, the car being the tongue, the garage being the roof of the mouth, then there's enough room in the mouth for the tongue. If the garage is too narrow, the tongue's going to have to squeeze in there. So if there's enough room from what we can see, then I'm teaching, okay, where does the tongue need to sit? So I get everyone to say the N spot. And when you say N and then you point with it with your tongue, you're pointing to that spot behind the two front teeth.
Mhm.
So just behind there, and then you're resting your tongue up from there. So it's resting on the roof of your mouth, and you're not pushing and splaying your tongue forward. It's resting behind and coming up. Now, that can be a challenge for people. And I
Mm.
even noticed that you were doing a little bit of that as well at first because
Ah.
not used to elevating your tongue, you're gonna curl it, you're gonna fold it, it might
Mhm.
air out,
My tongue's too big, it looks like, Alex.
and it may feel like it's too big, but it's kind of like learning how to walk on the balance beam for the first time in gymnastics.
Mm,
If I was
mm,
to get you up on a beam, what would your balance be like right now?
very wobbly.
That's what your tongue is doing right now. We
Mm,
have to work on toning the tongue, improving the musculature, improving the dexterity, just like you're learning certain exercises in yoga, karate,
mhm,
jiu-jitsu. Like think of, all these other
mm,
practices where you're learning something new. The body has to, you know, adapt to that. And the brain has to figure out
mhm.
how to do that in an effective manner.
So how many times a day? Like, anytime you have a second, you just place that there and just practice, keep practicing it?
So first, it's working with a myofunctional therapist because
Mm,
just telling people the exercises, it's really hard to know what to do unless you know the why behind it and know how to properly perform the exercises. So when you're working with a myofunctional therapist, just like I had you do, lift your tongue up to the roof of the mouth. Where's that end spot? Can you rest your tongue up high? And when you click your tongue, I can hear what your suction's like. So I can hear that you've got a great start to your click, but there's room for improvement. There you
mhm.
go. So the more that you do this every day, that's a great exercise, not just for
Hmm,
adults, but also for young children. It's called a click.
okay.
And the more you do it, the better your suction will be, and it will improve your tongue posture.
Mm.
Because now your tongue is getting used to doing something new and it's going to help support elevation. And if you have tension under your tongue, then now there's certain exercises we can do to help stretch that tight fascia underneath the tongue
Mhm.
so that
And
there's
that's
more
part of the myofunctional work that you would do on the person
part of the
as well?
myofunctional. Yeah,
Uh-huh.
exactly.
Now,
You
do
can
you
see that.
actually do hands-on or no, it's just,
So it's not
instruction?
hands on. It's like working with a personal trainer, but
Okay.
there are people that do myofascial work in the mouth. So that could be
Yeah, I've seen that.
Yeah, that could be a myofunctional therapist or sorry, um, massage therapist,
Mhm.
osteo sorry, I'm losing all my all my terms right now. A chiropractor.
Osteopath? Mhm.
Yes, yes, an
Mhm.
osteopath or a chiropractor that has myofascial training in the
Right.
mouth. So
Okay.
it can be a body I call them bodywork practitioners
Right.
because they have a foundational license and then they can take additional training and
Mhm.
get designation.
And so I also removed my wisdom teeth, but my bottom ones, they were so close to the nerve that they literally just cut them. So they couldn't actually remove because they were afraid that it might disturb the nerve. So why should we not be doing that? Getting rid of our wisdom teeth?
And that's a big topic. That's a
Mm.
big conversation topic, and I hear it a lot. But the problem is you have to have this conversation when your children are 1, 2, 3, 4, 5, not when they're 10, 11, 12, 13, 14, 15 to 18. I just had an 18-year-old last week, and the parents were like, "Oh, shoot, we have to take the wisdom teeth out." And it's like, we didn't have that conversation to develop the face and the
Mm.
musculature and the bone density at a young enough age. So we're losing space because of our modern systems.
Wow.
Our processed food is too soft. Our mouths are open when we're mouth breathing, so our faces are shrinking. We're spending a lot more time sitting, so our
Mhm.
bodies are not developing as functionally as they could. So
Mhm.
we're developing soft bodies. Like even the chair that I'm sitting in and the car that I drive, and the chairs that we sit while we're at work, it's
Mhm.
not supporting our overall structure. So we have to be having these conversations early enough so that
Mm.
it allows for enough room to develop. And then potentially the wisdom teeth may not need to come out.
That's great news for sure. And so I see how you're taking a holistic approach on this. How do environmental toxins or maybe just toxins in the food as well, how do they affect the our breathing and the oral restriction airways?
So I'm going to use an example of processed foods. If we were to go to get fast food takeout, like a burger and fries, we eat that, that's causing a lot of inflammation in the gut. So
Mhm.
it's impacting our inflammatory response. It's
Got it.
creating an inflammatory response. So if it's creating inflammation, like a
Mm,
lot of people struggle with eating dairy because they get congestion and they get
yeah,
sinus and they get lots of, they have to clear their sinuses. So if they're getting a lot of inflammation, it's going to affect the tonsils and adenoids because it's part of the lymphatic system.
right.
So because of that, you have to be able to drain effectively. And so if we're eating real food that's not sprayed full of chemicals, hasn't been created in a factory, we should be able to eat the food and not react to it. But as
Right.
you know, that's becoming a lot more challenging.
Mm,
A lot more things coming at us in our environment that is causing a lot of detrimental effects. So I think the big topic of conversation right now is inflammation, the gut
mhm,
microbiome, and how to support these so that you
mhm.
don't run into all these other health issues,
Right.
cavities, crowded teeth, um, yeah, gut and oral microbiome issues.
Right, right. It is all interconnected for sure. So, speaking of interconnection, how does it impact our sleep? And can we reverse sleep apnea or any other sleep issues with proper breathing?
So sleep apnea is a diagnosed condition.
Hmm.
So I cannot diagnose it, and it has to come from a sleep physician. So when someone comes into the practice, whether they're a child or an adult, the gold standard is a sleep study, which is an ambulatory sleep study. So you go to the hospital, they hook you
Hmm.
all up to, all the
Mm,
information, gather those records, and then, bring them back to your sleep physician, medical doctor, and they review them. So we have to understand a few things. What is actually happening? Is it sleep apnea where you stop breathing? Or is it upper airway resistance syndrome? Or is it sleep disorder breathing?
What's the difference?
Okay. So what's exactly happening, right? So if you stop breathing or your breathing is restricted, that could be sleep disorder breathing or upper airway resistance syndrome. Sleep apnea is where you have an apneic episode where you stop breathing for 10 seconds or over.
Right. And so
So
what
you could,
causes that, the upper airway is it all the inflammation and the toxins and the posture and all of that that we discuss?
well, it's the weakening of our systems. They used to call sleep apnea truck driver syndrome
Hmm.
because they had a thicker circumference of their neck. They sat and drove a truck all day. So
Right.
they're not moving. They're usually
Yeah.
not eating properly,
Yeah.
generally speaking. And then their tone and musculature in their body is compromised and they might primarily be mouth breathing. They're not getting good quality air if they're not opening up the windows. They're on the highway. So even if they do open up the windows, it's impacting air quality.
Right.
So it was considered truck driver syndrome, or yeah, it used to be called truck driver syndrome because if you had those boxes and you checked those boxes, then they would say, maybe you should get a sleep study. But now they're seeing little petite women
Hmm.
struggling to breathe and having apneic episodes in their sleep. So, this is a huge topic and it's a big topic right now. And I find a lot of people are really interested and curious about sleep and
Yeah.
improving their sleep quality. And I think that comes from the wearable technology that's available now.
Mhm.
Fitbit, Oura Ring, Apple Watch. People are looking at their data and saying, what can we do to help support this? So, a first place to start is get the airway open. So, if the nose is clear, then we got to make sure the tongue stays up because the tongue actually staying up keeps the airway open.
Mm.
If the rest of the airway is not congested, and if there isn't closures happening down the tube, because now we're seeing snoring through the nose, snoring at the back of the throat, snoring down different air. So I call this the tube. And there's different pinpoints that can collapse in like a straw
Right.
and cause issues with snoring and allow people to breathe through their mouth. So it could be very simple or it could be more complex depending on what the structure of that individual looks like, whether they're an adult or a child.
Right, right. Wow, okay. But again, there's hope, right? They don't need to be struggling with sleep because sleep is so important. It's one of the pillars of health. And so if you're not getting that quality sleep because of those disturbances, yeah, definitely go get it checked out. First, thing that I tell my clients as well is if you're not sleeping properly, go do a sleep test. figure out what's happening if you're snoring and address it right away. So I
And
love
there's
this
2
because
and there's 2 t sorry, there's 2 types of sleep tests. There's the ambulatory one, which we talked about, which the medical doctor has to refer to a physician, and then
Mhm,
there's a take-home test. And so there are some airway-centric dentists that if there's a long wait and they
mhm,
want to be able to gather some data before starting a program, then you can take a test home. And
mm,
some of these sleep clinics have take-home tests. So it doesn't give you the full, scan of what's happening in the brain, but it does allow you to see other markers from
right.
a whole
Yeah, I think there are some apps as well that you leave on while you're sleeping, and it can actually also detect. I'm not sure how accurate it would be, but it can detect whether or not you're mouth breathing and or breathing properly at all throughout the night. So, okay, interesting. So there's options for that too, which is great. Yes, the wait could be
many
long. Mm,
many options. And I always tell people come in with the data. If you're worried about yourself or your child, bring that data in that you just mentioned
mhm,
from the phone, from the wearable technology, and take a video if it's of your child or of your partner,
right.
because that will show red flags of mouth being open. You can hear frequencies of how they're breathing, when they stop breathing, if there's weird movements in their body when they're breathing. You can see all of that from a video, and it may speed up the process if they're
Mhm.
concerned.
Yeah, because then you're getting closer to the root cause, understanding the root cause, and then applying the protocol appropriately personalized to that person, which is great. So, Alex, if someone is listening and wants to start improving their breathing, they're like, "Wow, this really resonates," and their oral health. What are like or three maybe simple things that they can begin right today?
First thing I would have you do is if you want to improve your breathing, close your lips and breathe through your nose and see how that feels. So if we do this right now, if I was to work with you, let's say we're on a client call right now, the first thing I get people to do is close your lips and now take a breath in through your nose and out through your nose. How does that feel?
Hmm. Yeah,
Do you feel
natural,
clear? Do you feel
normal.
clear? Do you
Hmm.
feel like there's any restriction? Do you feel congested? So I have them rate that from 1 to 5, 1 being super clear, 5 being super congested. And if
Mm,
they do feel like it's a little bit of a challenge to maybe breathing in is okay, but breathing out, they want to breathe through their mouth, then let's assess why that is and take
mhm.
a little bit of a deeper dive. So then I have them take their cell phone out, actually. And I have them take their cell phone and place it right under their nose with their lips closed. And then they breathe in
Right. Mhm.
and breathe out. And I can see even from your phone, you have nice airflow coming out of both sides of your nostrils. And it's probably hitting about a third of the way up on your phone. A
Mm.
lot of
Yeah,
people are not
exactly.
getting a lot of people are not getting airflow out of both nostrils.
Mm.
So they're trying to tape their lips closed and they don't realize they're suffocating themselves. So we have to understand, is there enough air coming out of your nose? And does it feel okay if you were to tape your lips closed for 3 to 5 minutes
Mm.
during the day, not at night, but just as we're doing the first evaluation? How does that feel? So, first checking, can I breathe in and out through my nose with my lips closed comfortably? And it doesn't feel restrictive. Then check with your phone because everybody has a phone. What does the airflow look like coming out of both nostrils? Is it equal or is one side severely more restricted than the other? And if so, why is that happening? And then the next test, you can tape your lips for 3 to 5 minutes while you're sitting at your desk. Does that feel okay? Or does that start to bring on a panic? If it does, we have to understand, is that actually a restriction in the amount of air that you're able to take in and out? Or is there a nervous system component to that?
Mm.
'Cause sometimes lip taping can cause anxiety for people because they feel
Right.
like they're not getting enough air. So then what can we do to open up to open up the nose to support that? And you've probably seen nasal dilators that open up the nose. There's boom boom essential oil sticks that people will use essential oils, to open
Mm.
the nose. And then another route is to look and see structurally what's going on.
Mhm.
There's a
Mhm.
straight
To be addressed. Yeah, exactly. Wow, super cool. I love this. I love this. I can talk forever. But we do, have a limit to the podcast. So tell us, is there a common advice that you tend to give your clients after so many years of practice? I'm just curious.
Once you can support your breathing, that changes
Mhm.
everything, like you just mentioned. If you're not breathing well during the day, you're not breathing well at night. If you're not sleeping well, if you're breathing through your mouth while you sleep, you're actually keeping your system and your nervous system in a sympathetic state. You're more in fight or flight than you are in rest and digest. So you could be sleeping 8, 9, 10, 11 hours at night, but you may not be getting quality sleep. So
Right.
quantity sleep doesn't equal quality. And everybody knows once you improve your sleep, once you have a really good night's sleep, you are more alert, you're less irritated, you're more likely
Mhm.
to choose better foods, you're more likely to work out, you're, more social.
Mhm.
So
Mhm.
when we see children struggling with all the things that they're struggling with, we first have to look at their sleep and their breathing. And then I don't just work with kids, 'cause that's the biggest question I get. Oh, are you just working with kids? No, I work with families because anytime a child's coming in and being assessed and we're going through all the things we just mentioned, I have the parents doing this at the same time. I have
Good.
them blowing their nose, clearing their nose, wearing the same nasal strips that their
Mhm.
child is wearing, just a bigger size. And then I have them come in the next time and say, "How did that feel?" When you
Mhm.
walked out to your car after the appointment or you walked outside after a virtual call, how did it feel when you were wearing that on your nose? How did you
Mm.
sleep that night right after we got off that call the next day? Do you feel like you have more energy? Do you feel more well rested? Do you feel like you have a larger goalpost and bandwidth for stressors coming in to your life
Mhm.
that day? So that's where it starts.
Beautiful. Yeah, I love it. I love it. Very holistic approach for sure. So, Alex, tell us, what are your top three non negotiable self care habits you do on a daily basis?
So I don't look at my phone first thing in the morning. I go right outside and I ground, look at the
Hmm.
sun. I have this beautiful mushroom coffee I now use. And I try to get saunas in the winter. And
Hmm.
now in the summer, spending more time doing movement
Hmm.
based practices.
Yeah, I love that. I love that. So, tell us, what is your legacy? What do you want to be known for?
I think just being able to support families that they have more control and power over their overall health than they even realized was possible. We don't need to rely on medical providers to manage and maintain our health. My background is I'm actually a dental hygienist. I started as a dental hygienist first and then worked to be a myofunctional therapist. And dental hygiene was only created because of the industrial food revolution. So when we brought in processed foods, people needed their teeth cleaned because oral disease was happening. So my, vision is we shouldn't need the medical and dental industry like we, used to. We
Mm-hmm.
should be able to maintain overall health and over oral health. And if we need them, then they're there for a reason, but we're overusing these services. We've been programmed and conditioned to say, you need to come in and have your teeth cleaned every 6 months. Well,
Wow.
why?
Yeah.
Well, because my dental insurance company says I can get my teeth cleaned every 6 months. Well, your dental insurance has no idea what your gum health is, what your
Mhm.
probing depths are, what your decay rates are, and they don't care.
Mm.
So if you speak to a provider and a practitioner who actually is diving deep into your health, looking at all the silos of health and helping to support you, then that allows you to walk into any room and with any practitioner and have an eyeball to eyeball conversation. Right now,
Mm.
practitioners are talking down to people and saying, this is what you need. These are the supplements. These are the medications. This is the
Mm.
therapy you need. So I like to meet people where they're at and I like to give them a foundation so that they can do their own research and then they
Mm.
can come at me at the same level and say, "Hey, this is what I read. This is what I want to do. How can you support me through this?" So I
Mhm.
don't just work as a myofunctional therapist. I do a lot of consulting
Right.
because a lot of
Mm.
people come back to me internationally and then say, "Okay, this is what I've been recommended. What do you think?" Because they
Right.
need
Yeah.
wrap their head around all these different treatment modalities, and then they have to sit with it and see if it's right for them. So
Very,
that's
very
why I like
empowering. Yeah, very
short.
empowering. Yeah, you're empowering us to make our own decisions based on the research and doing it together so that it's you're we're in the driver's seat, and we're just consulting you instead of relying on others to make decisions for us. So let me ask you this, what are your thoughts on root canals?
That
That's
is a
another big one, I
other
know.
question now. And so actually you can go back to Weston A. Price and look this up. He was studying root canals way back, and he actually took root canal teeth and embedded them under the skin of bunny rabbits and realized that they would get the same illnesses that were in the tooth and they would pass away.
Wow.
So, root canals are chronically infected teeth. They're never fully disinfected or treated because root canal teeth are porous. If you look at a tooth under a microscope, it looks like honeycomb. So
Yeah.
the nerves have this access to the outer portion of the tooth. So when you're doing a root canal, you're only addressing that large middle nerve, whether there's one, two, three, depending on what the
Mhm.
structure and type of tooth that they're addressing. But then there's all these accessory nerves. So if you look at a tree, you see the big roots and then you see all the little accessory roots from
Right.
there. You can never fully disinfect those roots.
Wow.
So there's a time and place for a root canal. If you were to walk outside your door and get hit for whatever reason and the tooth dies, that's the time and place for a root canal because
Mm,
you may not be in the position where you want the tooth extracted
got
and
it.
then an implant placed in like that. So I always tell people if you feel like your gut, you're not ready to get rid of a tooth, it can be a placeholder
Right.
until you're ready to make a more informed decision. But it's
Um,
never a long term solution.
right, right. I love this. Wow, I could talk forever, Alex. Amazing. Such an eye-opening conversation, insightful. I've had a few people talk about this, but not in the depth that you have. So thank you for these new insights. Thank you for reminding us that this research has been around since the 1800s and to follow a more holistic lifestyle and diet and ancestral, what works for us, chewing our foods, more hard foods, not so much, soft, processed foods. Just a beautiful reminder of the amazing power of our breath and breathing. And I love to say, I don't even know where I got this quote, but once you just the whole mental aspect of breathing well too, once you can control your breath, no one could take away your peace. And it's so beautiful how it's really interconnected, your mental health with your breathing and now oral health with the rest of your health. So thank you so much for sharing your incredible knowledge. Where is the best way if somebody wants to work with you, they want to connect with you, they want to just follow your amazing work that you're doing?
Yeah, so functionaloralhealth.ca is my website. That's where I see clients one on one for in person and virtual consultations. And whether they want to work with me as a myofunctional therapist or they just want a whole, picture of kind of what's going on. And then if they want to decide that they want to get started immediately, I also have a course on my other business profile called buildinghealthyfaces.com. So that was my way to connect with people internationally so that
Mhm.
we can have these conversations as well. I call them health strategy calls so that they can kind of nail down what their chief concerns are and then where they need to go moving forward. So that website, buildinghealthyfaces.com, has my breathing optimization program. And from there, I'm going to be launching more programs so that families can be able to walk through the exercises, do their own assessments, do the breathing exercises, complete nasal hygiene and breathing optimization, like what I would do if I was working one on one with someone over a virtual program.
Incredible. I love how you have these options and people can work with you internationally. So that's amazing. Thank you so much for being here, sharing your incredible knowledge, the mission that you're on. It's just so inspiring. And I want to thank you for taking time to share your amazing energy with my community. Thank you. Have yourself a beautiful day.
Thank you, Rita. You as well.
Thank you for tuning in to the Self Care Goddess podcast. If today's episode inspired you, share it with another woman who's ready to reclaim her vitality and lead from within. To continue your journey, be sure to subscribe, leave a review, and connect with me on ritasavoya.com. Until next time, remember self care isn't selfish, it's your superpower. Take a deep breath in, exhale, and keep rising. Ciao for now.